Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. We're talking about long COVID today. Sometimes people get over COVID-19 quickly and don't experience any symptoms after. Sometimes it's a little bit longer. So how long is it? What are some of those symptoms? And what's some of the help out there if you are dealing with this? We're talking with Dr. Michael Amos about this today. Thanks for being here.
Thanks for having me.
COVID-19 has been around for a while now. What are some of the symptoms of long COVID that people may not realize that could be lingering from the infection?
Yes, so you think of things that have come on since you had the infection or even the suspected infection, and then you're thinking about things like brain fog, belly pain, shortness of breath, just a general sense of rundown. All of these kind of things and more have just sort of started after the infection and then have been ongoing for at least a month or two for you to be considered in long COVID. It's kind of an interesting phenomenon, but up to 30% of people can experience it.
It's a long list too, because there's also breathlessness. Some people report hair loss. I mean, it's so many different symptoms. You said 30%. Is there someone who's more likely to get long COVID? The more infections do you have? Does that up your chances?
They have been looking at the number of infections that you've had. They've also shown that folks with pre-existing conditions like high blood pressure, obesity, diabetes are more prone. And then sort of set factors such as age greater than 50, females more than males. All of these things sort of lead into a greater chance and propensity to have long COVID.
So is there an average that these symptoms last? I know we're talking about long, is it weeks, is it months? Do they ever go away?
So studies are ongoing, I'll say that, but right now most of the literature has it pegged at months as the duration, but through intensive management, we are trying to combat this as best as possible.
It does take a while to feel better after you've had it, for sure, and just about everybody has had it at this point. What about being diagnosed and treated for COVID-19, long COVID?
Yes, so really it's going to be based on your clinical picture. So one, having the diagnosis of COVID at some point, and then two, looking at the symptoms that they've started after and started to kind of become more of a daily occurrence for you. And then also we look at other diagnoses as well to make sure that we're treating not just long COVID, but if there's another diagnosis that maybe emerged after you had COVID, then we can try and target that as a cause.
What are some of the treatments that you can do? Are there lifestyle changes? So does exercise help? Do vitamins help? Or is it just case by case by case with what the symptoms are?
Really, they are based on the symptoms. Of course, if someone is suffering from chronic shortness of breath due to long COVID, then they would recommend maybe a stepwise approach to trying to do activity, trying to maybe today make it to the mailbox, next week we make it out to the front lawn, and just little by little trying to progress back to normal life. But that's based on symptoms largely.
Yeah, it is encouraging to know that this is a thing, because some people feel like, I'm just never going to get better. This is not all in their heads. This is something that is being heavily researched right now.
Yes, through NIH grants and everything around, there are possibilities for us to find a way to come back from this, despite it really affecting a large percent of the population that's been affected by COVID.
Any final thoughts on long COVID and when you should really be seeking help?
I think the number one thing is to realize that it is a diagnosis that we are working with, to realize that there is hope, but it is going to be a long process to come back from. But there is a possibility to do that.
Dr. Amos, thank you so much for your valuable insight. We appreciate it.
Thank you.
Thanks for checking in for Monday Health Minutes.